Hello students, I am Srishti Tiwari here. Today we are going to discuss about the next chapter, chapter 3rd, that is human relations. So we'll see the introduction about the human relation. As we know, human relation are the fundamental in the civil or in the society. Okay, it's a fundamental means the basic. It's a basic relation we can say. Okay, it's a basic thing. Then and each profession, if we are talking about the society also, and if we talk about any profession, not only in the society or in if it is related to social science, okay, it also related to the psychology and the social worker and in the healthcare team also. Okay, so as we know, nurses are the one of the largest group we can say. So they are only the one, they are constantly interacting with the patients, their relatives, and with the colleagues, as well as they are interacting with the multidisciplinary healthcare team inside or outside in the healthcare organization. Okay, so nurse should understand about what is human relation. Okay, means the if nurse will able to know what is human relation, through that the nurse will get to know what is the behavior of the next person, means the whom she is having the relation or with whom she is working or with whom she is interacting. So nurse must we should be equipped and she should have the skill in the science of human relation to carry out their professional and the personal life and responsibilities more effectively and efficiently. Okay, so next we will see the definition of the human relation. So first definition is being given by the Keith Davis. So what this writer is saying, human relation is an area, it's an area, it's an area of management. Which area? It's an area of management practice. Okay, what it does, which is a concern with the integration of people into a work situation. It helps in the integration of people, it helps the people to integrate in the work situation, means wherever they are working, to motivate, in which way? That motivate them to work productively, cooperatively, and with economic, psychological, and social satisfaction. Okay, means that if any organization or any industry in any institution, the person is working or the people is working, if they have the good interpersonal relationship or the good human relation, or they have the appropriate or effective human relation, so that relation will motivate them to work productively, cooperatively, and they will have the whether the economic and the psychological and the social satisfaction. We are going to see the next definition, that is the simple definition. Human relation are the relations between human beings that are affected by many other factors, and it also helps in accomplishment of the goal of an organization. Okay, next we are going to discuss the human relation in the context of nursing. Okay, the human relation in nursing refers to a relationship of nurse with the colleagues, means the nurse have the relationship, means we are talking about the nursing. So if the nurse is having relationship with her or his colleague and other departments and other department personnel, healthcare personnel, and the nurse with the patients. So the nurse will have the relationships with whom? With her or his colleague, or the departments, means intra departmental, or with the patient. Or in other words, the same thing is being written here, it is the intra departmental, means the with the colleagues. Okay, then interdepartmental means colleagues, and the intradepartmental means the other healthcare personnels, means related to the other department they are. Okay, and the interpersonal means they have the relationship with the patient's family or with the patient. So that what it helps means the human relation, if the nurse is establishing in the nursing with the colleagues, with the intradepartmental or the interdepartmental or interpersonal, means the patient with the patient or with the family, so it provide to the quality care to their patients. Okay, then the a nurse patient relationship between them, so what it helps means if they will establish the interpersonal relationship or the nurse patient relationship between the nurse and patient, they will interact with each other face to face. Okay, then for what they are interacting, so they will interact to face the health deviation, means the patient will have the health deviation. Okay, some health deterioration is there, so that's why the patient is interacting with the nurse, isn't it? So they will, why they will interact, they will interact each other to face the health deviation. They will means the patient will share the what is the health problem is there, and the nurse will try to bring it the resolution, what the patient is having the problem, nurse will try to resolute it. What means the means nurse will give the care to the patient, and the whatever the patient problem is there, that patient will get relief. Okay, and they will discover the way of adapting to the situation, means whatever the situation in their environment, so they it will help to adapt the situation. Okay, and if the nurse is having the relationship with the healthcare personnel, or they interact with each other, so it also helps to achieve the primary goal of the maximum patient satisfaction and health promotion, and irrespective of their field of work. Okay, so in the human relation in nursing, we will discuss about there are two things: dimensions of the human relation in the nursing and the strategies to promote cardinal human relations. Okay, so we will discuss first the dimension of human relation in nursing. Dimension of human relation in nursing, there are being 4 points, so we'll discuss one by one. Means the nurse patient helping relationship, nurse family relationships, nurse health team relationship, nurse community relationship. We will discuss one by one. First one is the nurse patient helping relationship. Okay, as we know, helping relationship are the fundamentals of the clinical nursing. Helping relationship are the fundamental, mean the basic, that I have already told, of the clinical nursing practice. The nurse assumes the role of professional helper, means nurse will assume the role of professional helper in the such relationship, and come to know the patient as an individual with a unique help need. Means nurse will know the patient that every individual is unique, so the need also will be unique of the patient. Okay, then next one is the nurse family relationship. Many nursing situations, especially those in the community and the home care setting, means if the nurse is going for the day care in the home of the patient, so they require the establishing the nurse family relationship. Okay, the nurse to form a helping relationship with the patient's entire family. Like the nurse, if we'll talk about the patient will be the only unit of the family. Okay, so if the nurse is going for the home care setting, or the nurse is going in the community, so the nurse should understand what is the human relation, means what is the relation is being established in the family. Okay, what is the environment of a relation in the family, so nurse should understand that. Okay, then third one is we are going to discuss, that is the nurse health team relationship. Okay, health team means in the healthcare team only, in the hospital setting. Okay, so many nursing situations, especially those in the community. Okay, In a nurse health team relationship, a nurse functions or the role requires the interaction with the multiple health team members, and the many elements of the nurse patient helping relationships also apply settings and communication. The such relationships may be geared towards team building, means if they will have the good interaction with the colleagues or in the interdepartmental or the interdepartmental team, so nurse will have the good team building, and it will facilitating in the group process and the collaboration and the consultation, whatever they should have the consultation regarding anything, and the delegation of the work and the supervision and the leadership and in the management of anything. Okay, so if the nurse will have the good relationship with the healthcare team members, so it will give it will provide or it will strengthen the teamwork, and they can achieve the organization goal effectively and efficiently. Okay, next we are going to discuss about the nurse community relationship. Many nurses from forms a relationship with the community group by the participating in the local organization. Okay, if they are working in the local organization or in the volunteering of the community services, or by becoming politically active nurse, a community based practice. Okay, so wherever they are working, so nurse should have the this community relationship, and they should know about the what is the behavior is being established in the community, so nurse should understand that. Okay, so next we are going to discuss about the strategy to promote the cardinal human relations. Okay, so there are so many points is there. First one is group cohesiveness, strengthening a sense of oneness, effective communication practices, policies to promote coordination and cooperation among employees, common organizational goal, defined organizational structure, training and skill building in human relations. We will discuss one by one. In group cohesiveness, cohesive meaning the quality of a forming or a unite as whole, means the uniting the group. Okay, that is meaning of cohesiveness. So in the group cohesiveness, in the personnel may be helpful in the generating the B feeling. Okay, that I have already told. The meaning of cohesiveness mean uniting someone or to have the B feeling among the organization. So it will promote a positive human relation in the group of worker. Okay, then the next heading, that is the common organizational goal. In the common organizational goal, there must be promotion of common goal perception in the personnel working in an organization, means the whoever the people or the personnel, those who are working in an organization, they have the common goal. So it will help in the promotion of the common goal if they have the good interpersonal relationship on or a good interaction with the healthcare means personnel, those who are working in the organization, and it will strengthen the relation further. Okay, then next we are going to discuss, next point is that is a strengthening a sense of oneness. So it can be same as the V feeling. Oneness means they will be together always. So inculcating, okay, means explain and strengthening a sense of oneness in the employees or in an organization, helps to establish positive human relation, means they will have the good human relation and positive human relation that will ultimately beneficial for the organization to achieve the organizational goal if they will have the good interaction and the good human relation among them. Okay, then next point is the defined organizational structure. A well planned defined organizational structure can affect human relation. Okay, human relation in an organization, it means if the good organizational plan will be there in any organization, so that can affect the human relation. There should be a sound organization mentioning duties, expectation and the job responsibilities clearly for everyone. Okay, whatever their duties and responsibilities and expectations are being divided for the in any organization for every individual, so that should be clearly defined, so the their relations will be established, that will be effective for in an organization. Okay, Then the next point is effective communication practices. In the effective communication practices, uh, effective communication practices in an organization are the key for establishing positive human relation. Okay, therefore to create a positive human relation environment in an organization, it is a essential to practice efficient communication practices. Means from the first chapter onwards we are discussing, or we have understood about that. Means that in every aspect the communication is important. The communication has to be effective for establishing our interpersonal relationship or for establishing human relation. Okay, then next point we are going to discuss, that is the training and skill building in the human relation. In the modern healthcare industries, it believed that the employees can be trained. Means according to the modern healthcare industries, it is believed that, or it emphasizes that the employees can be trained and their skills build pertaining to human relation to achieve the constructive organizational environment. Means according to the modern healthcare industries, they believe that the person's skills can be pertained if they have the good interpersonal relationship, skill of good human relation, that will helps in constructive for the organizational environment. Okay, next and the last we are going to discuss, that is the policies to promote coordination and the cooperation among employees. In the promote for the promotion of coordination and cooperation among employees, each institution must have the policies and the procedure to promote the coordination and the cooperation with their employees, so that the positive human relation milieu can be created. Milieu means we can say a group or a community. Okay, so that can be established. Mean good human relation can be established if there will be the policies or the procedure for the promotion of coordination and the cooperation. Okay, then to have the effective human relation and the policies, framer should keep in the mind that human being have the emotions, drives, thoughts and feelings. Okay, so all these things should be kept in mind while creating a policies or procedure for the promotion and the coordination and cooperation with among employees. Okay, so these were all about the today's topic. If you people have any doubt, you can ask. I'll try my best to clear your doubt. Thank you all.